The discovery that immune cells can be manipulated by cancer cells has opened up a new era in cancer research, offering promising insights into how the body's own defense mechanisms can be harnessed for treatment. Instead of focusing solely on the tumor itself, researchers are now exploring the complex environment surrounding cancer cells, known as the tumor microenvironment. This shift in perspective has led to innovative therapeutic approaches that could significantly improve patient outcomes. One of the most exciting findings in recent years is the role of inflammation in cancer progression. For decades, scientists have observed that chronic inflammation is linked to an increased risk of various cancers, but the exact mechanisms remained unclear. The breakthrough came when researchers discovered that tumors actively reshape their surroundings, recruiting immune cells in a way that helps rather than hinders their growth. This insight has led to the idea that blocking specific inflammatory pathways could slow or even prevent tumor development. The work of tumor biologist Florian Gretton has been instrumental in advancing this field. His early research at the University of California in San Diego revealed that a key inflammatory pathway, controlled by the transcription factor NF-kappa B, plays a crucial role in tumor growth. When this pathway was blocked in mice with colorectal cancer, the tumors grew more slowly. This was a groundbreaking finding because it demonstrated that targeting the immune cells around a tumor, rather than the tumor cells themselves, could have a significant therapeutic effect. Since then, research into the tumor microenvironment has expanded rapidly. Scientists are now investigating not just macrophages, the immune cells that are often co-opted by tumors, but also fibroblasts, blood vessels, and other components of the surrounding tissue. These elements all interact with cancer cells in a dynamic way, influencing how the disease progresses and how it responds to treatment. By targeting these interactions, researchers hope to develop therapies that enhance the body's natural ability to fight cancer. One promising area of exploration is the use of existing anti-inflammatory drugs in cancer treatment. The observation that people who regularly take aspirin have a lower risk of colorectal cancer sparked interest in whether similar medications could be repurposed for broader cancer prevention. While the exact mechanisms are still being studied, it is becoming increasingly clear that inflammation suppression can create a less favorable environment for tumor growth. This insight has led to clinical trials testing whether drugs that inhibit inflammatory pathways can improve the effectiveness of chemotherapy and immunotherapy. Another major focus is on immunotherapy, which harnesses the power of the immune system to fight cancer. One of the most successful advancements in this area has been the development of checkpoint inhibitors, drugs that prevent tumors from disabling T cells, the immune system's natural cancer-fighting agents. While these treatments have shown remarkable success in some cancers, such as melanoma, they are less effective in others. Researchers believe this variability is due to differences in the tumor microenvironment. Some tumors create physical barriers that prevent T cells from penetrating, while others produce chemical signals that suppress immune activity. Understanding these mechanisms could lead to new strategies that make immunotherapy more effective across a wider range of cancers. The future of cancer treatment may lie in personalized combinations of therapies tailored to each individual's tumor characteristics. Rather than relying on a single approach, doctors could use a combination of inflammation blockers, immunotherapies, and targeted treatments to address both the cancer cells and their supportive environment. By strengthening the immune response while simultaneously disrupting the tumor's ability to manipulate its surroundings, researchers hope to develop more durable and effective treatment options. This growing body of research highlights an important shift in how we think about cancer. Instead of viewing it as an isolated disease that affects only a specific organ, scientists now understand it as a systemic condition influenced by complex interactions within the body. This perspective opens up exciting new possibilities for prevention and treatment, giving hope to millions of patients worldwide. By continuing to explore the relationship between inflammation and cancer, researchers are paving the way for therapies that not only extend life, but also improve its quality.